Good morning, everyone. We will learn the shock and emergency measures. Shock is a syndrome characterized by a sharp decrease in effective circulating blood volume caused by various pathogenic factors, resulting in insufficient microcirculation perfusion of organs and tissues, leading to tissue hypoxia, cellular metabolic disorders, and organ dysfunction. Lowering blood pressure is its most common and important clinical feature. Learning target. 1. Familiarize oneself with the classification and clinical manifestations of shock. 2. Master the general principles of handling. Contents. 1. Classification of shock. 2. Clinical manifestations of shock. 3. General principles for handling shock. 4. Reflection section. 6. Test. Classification of shock. 1. Hypovolemic shock. Hemorrhagic or hypovolemic shock is a systemic blood volume deficit caused by rupture of large blood vessels, gastrointestinal bleeding, or visceral rupture. 2. Cardiogenic shock, caused by impaired cardiac function, such as acute myocardial infarction, various myocarditis, arrhythmia, acute pericardial effusion, and other heart diseases. 3. Infectious shock. Toxic shock, caused by pathogens, toxins, and antibody complexes, such as sepsis, intestinal infections, toxic dysentery, etc. 4. Allergic shock. Allergic reactions of the body to certain drugs or biological products, such as penicillin, tetanus, and diphtheria antitoxin, serum allergies, etc. 5. Neurogenic shock. Menstrual shock is caused by traumatic pain, brain and spinal cord injury, and anesthesia, accidents. Clinical manifestations of shock. Clinical manifestations of shock. Pale, cyanotic, and damp cold skin. Pulse rate of over 100 beats per minute is weak. Blood pressure drops, generally to 80-60 mmHg, 10.67, 8.00 kilopascals, with a pulse pressure difference of less than 30 mmHg for 0 kPa. Decreased urine output, less than 25 to 30 milliliters per hour. General principles for handling shock. 1. Quickly rescue and call emergency doctors. Do not move patients around. 2. Ask the patient to lie flat on their pillow. Raise their lower limbs by 30 degrees. Keep quiet. Avoid excessive movement. Turn their head to one side. Prevent vomit from blocking their airway and keep warm. 3. The patient is conscious and can drink a small amount of sugar salt water or diluted salt water. They cannot drink plain water and can take oxygen. 4. The treatment of the primary disease is the key to treatment, and targeted treatment should be implemented according to the cause of shock. Note 1. Immediately apply hemostasis, bandaging, and fixation to open trauma. Oral administration of Yunong Baiyao and Luozul, intramuscular injection of hemostatic drugs, etc. Any drug-induced anaphylactic shock must be immediately stopped. Blood pressure and pulse checked, breathing observed, and adrenaline glucocorticoids, vasopressors, desensitizers, etc. given immediately. Attention to, for septic shock, antibiotics, corticosteroids, etc. should be given. For cardiogenic shock, administer antiarrhythmic and cardiotonic drugs. Reflection section. 1. What are the classifications of shock? 2. Describe the general principles for handling shock. Test 1. Shock caused by myocardial infarction is allergic shock. B. Hemorrhagic shock. 100. Cardiogenic shock. Select option C. 2. Shock caused by bleeding from gastric and duodenal ulcers should be treated as soon as possible. Pain relief. B. Hemostasis. C. Fluid replacement. Select option B. 3. The reasons for septic shock include septicemia. B. Major surgery. C. Myocarditis. Select option A. The above is the relevant knowledge on shock and emergency measures. This lesson ends here. Thank you all. See you next time.